Welcome back here to Midday Kentucky. We wanted to bring our viewers out to Clark Regional Medical Center today to learn about their new technology, a 3D mammogram. So I'm joined now by Tamala Humphreys, your supervisor of mammography. Now, Tamala, before we get into this technology, let's talk about the standards here. When should women start thinking about getting a mammography?
Typically, women should start at age 40, start screening at age 40 every year after that, unless they have, unless they're a high-risk patient with family history or have some other problems.
And there are different types of mammography. You've mentioned diagnostic. What do you do here?
We do both screening and diagnostic here. Screening is an asymptomatic patient, which means you're not having any problems. It's a yearly exam. Just for screening purposes. A diagnostic exam is a little bit different. It's usually done on women that are having a problem, and those are used, we do those a little bit differently, but we do both of those here.
Now let's talk about this new technology you're offering your patients. This is the 3D mammogram. What are the benefits?
A 2D is kind of like, looking at a book. You can see the cover and the sides. The 3D mammography actually opens up those pages, so you can actually see what's inside and on each of the pages. So it's especially good for people with dense breast tissue because it allows us to see through that dense tissue and allows us to detect things, of course, much earlier.
All right, and now we want to bring in Dr. Benjamin McQuaid. He's a radiologist here at Clark Regional Medical Center. And Dr. McQuaid, we wanted to ask you, as a radiologist, what are the benefits you see to this 3D mammogram technology?
3D mammogram technology, or tomosynthesis, gives us a better ability to pick up small breast cancers at an early stage.
Okay.
It really increases our ability to see invasive breast cancers. The American Cancer Society states that it increases our ability to see breast cancers somewhere between 27 and 40%.
And we know that's what you're focusing on, detecting those abnormalities. So for people at home that maybe need to get a mammogram, would you recommend seeking a facility with this 3D technology?
Since it has been shown to be more sensitive and better for early detection, I think it offers a significant benefit.
And is this something that people should be scared of? We know we see this technology and you're scared to know, but with some of this technology like the 3D, being able to catch it so early, people shouldn't let fear stop them, right?
Well, we shouldn't, even though that's human nature, because no one wants to be diagnosed with cancer. But breast cancer can be cured, completely cured. So if we can find it early, the chance of a complete cure is much greater than if it gets large enough that it becomes a huge surgical and medical problem to treat.
All right, Tamala, so walk us through the process of using this 3D mammogram once a patient arrives.
Once a patient arrives, they're registered, of course, and then they come back to this room. They change here in this room. One of our technologists go over family history and things like that with the patient. Then we explain to them exactly what we're going to do with the machine. We typically do 4 views for each mammogram. The only difference between 2D and 3D for patients is breathing techniques a little bit different, but for the most part it's the same as it always has been. There's one from the top and one from the side for each breast. Compression's uncomfortable, but it's never anything you can't stand. And then in 5 minutes we have, a screening exam that can possibly save your life.
So how can people at home, maybe you're in that age range or you have family history, you need to get a mammogram, and learning about this 3D mammogram, how can people schedule an appointment here?
You can actually schedule an appointment if you're symptom-free, never had a history of breast cancer, or over 40. You can actually do, it's called a self-requesting mammogram. You can do that once a year, and that just takes the place of the order for the mammogram. So you can actually call, make your appointment, and do your own order once you arrive in the department. If you are having problems, you would need to see your physician first, so that they could decide exactly what we need to do for you.
We're going to put all that information up on the screen and link it over on our website and Facebook page so that you can get information on this new technology, again, the 3D mammogram out here at Clark Regional Medical Center. But for now, let's send things to break. We'll have more Midday on the other side.